Hello everyone, my name is Raymond Nguyen, and I'll be presenting my case study on the multi-state outbreak of Salmonella Wandsworth infections linked to veggie booty. The outbreak has been reported to the CDC officially on July 18 of 2007 by 20 different states. All of the patients had diarrhea, 76% had bloody stools, and 6 were hospitalized. Initially, the outbreak was small, having only 8 cases reported to PostNet from 6 states before May 1, 2007. However, the cases gradually increased. A case control study done by multiple states all led to strong associations of illness to the consumption of veggie booty. Veggie booty is a snack made of puffed rice and corn with vegetable coating. The Minnesota Department of Agriculture laboratory was able to isolate a strain of Salmonella Wandsworth from a sealed bag of veggie booty from a retail store. Furthermore, veggie booty was identified to carry strains of Salmonella typhimurium as well between June 1st and June 27th of 2007. On June 28th, a voluntary recall was made and no illness of Salmonella Wandsworth were reported since. On July 2nd, the company also voluntarily recalled their product, including related items such as Super Veggie Tings Crunch corn sticks because it shared the same ingredient. Currently, the Salmonella Wandsworth outbreak is over. However, for future cases and prevention, Salmonella can be diagnosed through laboratory testing. The process starts with the clinical diagnostic laboratories in which they would culture a patient's sample. This sample may be from stool or blood. They would then send Salmonella isolates to state and territory public health laboratories for serotyping and DNA fingerprinting. Results from the public health laboratories would be sent to CDC's laboratory-based enteric disease surveillance and to PostNet. Serotype is a great process to investigate outbreaks because it helps trace sources using similar bacteria. The main issue we need to focus here is raw meat and sanitation. Salmonella does not have any real symptoms but rather causes. These causes include the spread of bacteria as well as the consumption of raw food. Raw items include undercooked meat, poultry, eggs, or egg products. There have also been an indication that spices can be causes as well. The U.S. Food and Drug Administration have been able to trace contaminants in spices. There are 3 key ways to prevent a Salmonella outbreak as advised by Mayo Clinic. The first is to wash your hands. Throughout the day, your hands come into contact with so many items that may contain harmful bacteria. It is key to avoid further contamination by sanitation. Another alternative is to be especially careful when you cook food. Be sure to separate items that involve raw food and other cooked food. If you are using a cooking board for meat, use a different one for cooked food. This also includes utensils and knives. Lastly, you can just simply avoid eating anything raw altogether. By thoroughly cooking your food, you can eliminate any harmful bacteria that may have been present in raw items. Upon the previous alternatives, I have some recommendations that I feel the public should enforce in order to prevent another outbreak of Salmonella. First, washing your hands frequently will be very helpful. After playing with your dog, doing your homework, using your computer, or any actions involving your hands, wash it with soap. Another way to avoid Salmonella is to avoid raw food. Use the appropriate items when cooking to help. For example, if you want to see if your steak is cooked all the way, use a food thermometer to check the temperature. When you are using a knife, make sure that knife is not used for both cutting raw meat and cooked food. Like any idea of prevention, we need to have a plan. Public health should start creating laws that would enforce stricter regulations on food products that are sold to the public. In this case, many bags of salmonella-infected veggie booty were sold to the public. If we can do a food regulation before the shipment of these products, then we may be able to prevent another outbreak from occurring. Bacteria has been a large factor towards the cause of salmonella. Providing a cleaner environment would definitely reduce the risk of salmonella. We can work on a project that introduces cleaner vendors and food stores. Education is key towards informing the public about an issue. Using school and media, we can stress the importance of cleanliness and promote small tasks such as washing hands frequently. Through the media and web, we can generate ads that encourages being sanitary. It would be ideal for the country to work the next 3 years in creating a better and healthy environment. By 2020, we should see the rates of salmonella drastically decrease as well as a new system of regulation. Getting sick because of unsanitary conditions have been common knowledge. Many of us have been taught since preschool to wash our hands before eating, yet we often get lazy and end up paying the price later on. I love to eat rare meat. It is tender and juicy. However, rare meat should be served only by proper places with regulations on their food. Some will have stronger stomachs than others. However, your body can only handle so much before an illness actually hits. In my opinion, play it safe by avoiding raw food as much as possible and frequently wash your hands. And that concludes my presentation. Thank you for watching.